All right, so this is Healing with Light Part 2. As I said, I'm Dr. Paul Despres here at Aspen Integrated Medical Center. I am one of three physicians here. I'm also a part co-owner of Aspen, and I am really excited to talk with you in more in-depth today about deep tissue laser therapy, also known as low-level laser therapy, also known as photobiomodulation therapy. I'm going to call it deep tissue laser therapy today, or sometimes just laser therapy. So the primary uses of this modality is to relieve pain, reduce inflammation, and promote tissue repair. The first slide, I just wanted to show some of the research. There's hundreds, if not thousands, of research articles supporting the use of laser therapy for a variety of different conditions and symptoms. These are just some that I wanted to highlight. The first list is from the American Physical Therapy Association, some research about using laser therapy for ankle swelling, nerve pain, chronic neck pain, plantar fasciitis. The American College of Physicians also has done a study on chronic low back pain. There are Cochrane reviews on carpal tunnel, plantar fasciitis again, lymphedema, frozen shoulder, rotator cuff issues, and on and on. So this slide, few of these slides are going to be the same slides with some edits of what I did with my previous webinar, just so you know. The four main categories of benefit from deep tissue laser therapy are acute and chronic musculoskeletal conditions, conditions with pain, inflammation, reduced range of motion, the stuff that is preventing you from skiing, from mountain biking, from playing with your grandkids, or also just kind of those nagging injuries or lingering chronic symptoms of like low back pain, shoulder pain, neck pain, can be really helpful there. It's also helpful for acute and chronic skin conditions. I wanted to highlight this time around of its beneficial effects on neuroinflammation. So brain inflammation is a common culprit for a lot of chronic brain fog or chronic fatigue syndrome. We're also seeing a lot of it in acute COVID and chronic COVID patients with lingering symptoms. And deep tissue laser therapy can be really helpful there. And I'll show a study about that in a moment. The fourth category of benefit is just helping you recover from daily activities of strenuous exercise. So if you're a runner, if you're a biker, you don't have an injury, but you want to recover faster from that event, from that just casual run after work. If you happen to do sprain your ankle, it's great for that. But just for people who want to repair a little bit faster. So I know some patients come in and they do laser therapy after golf. They say my back, usually takes a few days to heal after golf, but I can do the laser therapy and I'm good to go the next day for more golf. So there's also that aspect of just quicker recovery turnaround time. Here's a long list of all the conditions I think laser therapy is indicated for. I'm not going to get into all those words there, but our chronic joint problems, back and neck pain, brain injuries, fractures, wounds, inflammatory conditions, soft tissue issues, so it deals with ligaments and tendons, spinal conditions, so disc injuries, herniated disc, bulging disc, the nerve impingement disorders, neurodegenerative conditions is something that I've wanted to grow in as a clinician of how to treat. So early onset dementia, Parkinson's, and Alzheimer's. And I know colleagues have used this specific laser for preventing progression of Parkinson's. I already mentioned long COVID, but other symptoms of like Lyme disease, mold illness, and other chronic inflammatory conditions. Here's a second list of additional stuff I didn't list the first time. So skin conditions, headaches, lung conditions. And I highlighted lymphedema today because I had a patient who's having a lot of swelling in her extremities, and we actually noticed a good degree of reduction of that lymph buildup in her legs. and she went and saw her lymphatic drainage specialist, and she said lymph was moving faster or more effectively than she's ever seen with her. So it might have some added or future implications of doing laser before like massage or lymphatic work to get a more profound response from that type of treatment. Here is the study where they're using infrared light to relieve hyperinflammation induced by COVID-19. So the device that we're using is infrared light and red light. I even have another laser that does ultraviolet light, but predominantly lately I've been using more the infrared light because I think that has the most healing qualities. But it's really cool to see a study confirming things that I've been seeing clinically. Health benefits of deep tissue laser therapy. So yes, reducing pain, inflammation, increasing muscle recovery, regeneration, increasing metabolic activity, faster wound healing, rapid cell and DNA repair, regeneration of tissue. So I bring all this up because folks are like, well, how long benefits am I going to experience with this type of treatment? There is potential after reduced pain inflammation, some of these other benefits can provide more lasting benefits. So, I love chiropractors, I love massage, but sometimes I feel like you need to go at a certain regularity, monthly, every couple months to kind of keep yourself under control, or maybe every week initially from an injury. My hope is with some of the laser therapy that I'm doing here that I can get you guys in a certain place of recovery that I don't need to see you anymore. I mean, as much as physicians, as personally, I like developing relationships with my patients. I really want you out living your best lives and not having to come see me on a regular basis. So I'm hopeful that with laser, especially this newest laser, that I can see more prolonged benefits where we do an intensive treatment, whether 6, 10, 15 treatments up front, where I don't need to see you for months. And then we just need to do it if you like, let's say, tweak your back or tweak your ankle or certain things. The Light Force FDA indication statement. So we have a Light Force laser. It gets into the type of wavelengths they're using, 810 nanometers and 980 nanometers. The way they work is they're emitting these photons, this energy, and this through this particular spectrum of certain wavelengths. So different wavelengths have the ability to penetrate tissues on a deeper level and create more cellular changes. One of the benefits with the class 4 laser, you also get topical heat from the application. So there's some added benefit there, relieving some minor muscle and joint pain, stiffness, arthritis pain, muscle spasm, and increasing local blood circulation. So there is a temporary relaxation of muscle in that area related to the heat, related to the pressure if I'm applying to a muscle, and so forth. The target area, the main target area of its effectiveness is the mitochondria. So you can see the right here, the light source comes into the cell, it's penetrating, it's going through into the cellular membrane, or at least the membrane of the organelle, and increasing ATP energy production. So this is the main way that deep tissue laser therapy is causing so many profound benefits, is its ability to increase ATP. So ATP is energy of the cell. And I also like to think of it as the energy currency that's going to upregulate all those cellular activities of what the cell needs to do for repair, for regrowth, for reducing pain, for calming the inflammation and the immune response. So here's just a little outline of the basic mechanisms of actions. I already said, went over how ATP production helps cells, but these are the ways ATP production actually does help the cell. So it increases cytochrome C oxidase, increases the mitochondrial function. We're increasing oxygen consumption within the cell and the tissue. And overall, we're looking to restore energy balance and mitochondrial signaling. So if the cells can signal appropriately together, if they can signal more, it has the greater effect for healing. As far as deep tissue lasers' effect on acute inflammation. These are all the changes that research has shown of its ability to actually change that inflammatory soup, as this says here. So, we're increasing vessel production, so small capillary angiogenesis production. We're increasing white blood cell activity, energy, cell membrane changes. We're causing vasodilation of vessels. We're calming down certain inflammatory cytokines. We're changing ion gradients, reactive oxygen species are being reduced, and so forth. So all of these things can help reduce that inflammation and also at the same time cause some decreased pain. I mentioned how laser has ability to increase circulation. I get a lot of questions from my patients of like, okay, so we can reduce in pain, inflammation. How is it actually going to help me repair my joint? And so this explains how we can improve collagen deposition in the body around joints. And so this kind of happens through the increase in white blood cell activity, the vascular regeneration and cell regeneration, all of these things to accelerate this healing process and increase fibroblast proliferation. Macrophages are involved in the immune system, help modulate the immune system. So it definitely is playing a part on your blood vessels, but also modulating and educating your immune system on where healing needs to be done. So here just kind of explains what you might notice within minutes after treatment, and then also some potential lasting relief. So within minutes, we're looking at trying to decrease conduction of nerves. So this is why that gives pain relief. We're decreasing those nerve fibers, those nerve signals are being sent up to your brain that are telling you that, oh, this back is hurting, the shoulder is hurting. So that's one of the reasons why it's so helpful in the moment to give you some pain relief. Naturally, without surgery, without medications, that can last for a day or two, depending on the severity of your illness, whether it's acute or chronic. 20 to 45 minutes after treatment, we then notice there's more nitric oxide release. We have all these other inflammatory components that are decreased. And here you can see they say like a 30% neural blockade at about 10 to 20 minutes. So we're interrupting those nerve signals. Now, what I get most excited about is more the lasting relief category. This is where we're addressing that inflammatory soup. We're reducing these pro-inflammatory markers, and we're hopefully promoting some tissue repair for you. So I just want to remind everyone that we extended our 10% off laser treatment until August 18th. So please call and take advantage of that. So what's really cool about the deep tissue laser therapy device, which is right there, I can choose which particular treatment head that I want to use. Now, I choose this based on what type of tissues we're treating, how deep I want to get into the body. Something on the face, I'm going to be using something smaller, such as this little flat window. I also might use this small little massage roller ball. The ball allows me to get deeper into the tissues, but usually it's when I am over muscle, not necessarily over bone. So you could imagine if I was on bone, that would hurt, or I'd just be uncomfortable. So that's where the things like this little window are really good for things like TMJ. I'm able to hit this whole area. Sometimes TMJ, there's muscle related. I might use actually the massage ball, depending on the person. The larger massage ball, this one, I like this because this is great for large muscle areas. This little roller massage ball helps me push into the tissues and get a greater depth of penetration of laser therapy. So that's one thing about laser therapy that I want to bring up. There's a lot of devices out there, and it's decent. Some of them are decent. Different ones have different degree of power, but the more power that you have, like a class 4 laser, allows us to get deeper into the tissues. Not only does power matter, but something like this with the massage ball allows us to press into the tissues and get those photons closer to the targeted area. So let's say I was working on the hip, around the hip joint. Let's say I was working around the knee. I was working on the shoulder, some of the muscles in the shoulders and the neck. Something like this will help us reach the targeted tissues much more easily. We also have this treatment cone. Now, this is if we're over very bony structures, and I'm going to cover a lot of area. So I commonly use this, I guess, over the bony parts of the knee joint, the bony parts of the hip, sometimes over the spine, collarbone, areas where having a roller ball really wouldn't feel that well. And then we have our ultra fine one if we want to be really targeted exactly where we are at. So when I'm using this, what's great about this machine is I have the ability to do my own protocols. So based on what I'm seeing with patients is working the best, I can adjust tissue depth, I can adjust the power, I can adjust the length of treatment and the treatment area size. So it's very fine-tuned to what we're trying to address. In the operation, there are set protocols. I don't know if you'll be able to see all of this, but I'll do my best. There are set protocols based on, skin color, skin type, but then I get into the next part where I'm actually selecting which part of the body I'm treating. If I'm treating the shoulder, things that come up are like arthritis, capsulitis, ligament injury, rotator cuff injury, sprain, strain, tendonitis, bursitis, tricep, bicep, or post-surgical. And we see kind of similar stuff throughout the body. So if I look at the foot, arthritis again, tendinopathy, plantar fasciitis, sprain, strain, tarsal, tunnel, and post-surgery. So I can follow some of these acute protocols, but also I have the ability to make my own protocols and set exactly what I want based on what's going on with the patient. Oftentimes I feel like I'm doing more chronic disease management, so I'm doing this, more of the acute stuff, but it will vary depending on the person. Other things to mention, in case you missed my first webinar, treatment for each area really is only about 5 to 15 minutes or so. I can do one area at a time. We could also stack and do 2 areas. So if you have low back pain and shoulder pain, we could address both in the same visit. It'd just be a little bit longer of a visit. Treatment frequency. Initially, I really recommend people to get at least 2 treatments per week for maybe 3 weeks or 5 weeks. The more you stack on top of each other, especially early at the beginning, the greater potential for lasting relief. Which is what we're shooting for. I guess patient case studies that I've had recently. I had an individual with chronic ankle pain related to surgeries, related to different screws and metal implants, and kind of thought, he's going to kind of deal with this the rest of his life. I've seen him over the course of just 7 treatments so far, and in office, he gets down to 0 to 10 pain. He's waking up out of bed with less pain. And he actually told me today that he's been running. So he hasn't run in a long time. So that's really promising for me, and he's really happy about it. I haven't really had any patient cases where they come in and they say they feel worse. Usually everyone feels better. I'm able to usually get their pain at least down initially. Sometimes you might notice more of a benefit that day or the next day. I ask them to keep an eye on it. Look at different metrics of like, oh, it bothers me less when I'm sleeping, bothers me less when I'm working. I'm able to do different things with less limitations, which is good. Been doing a lot of low back, psoas, other ankle pain, knee pain, shoulder, neck pain, TMJ, thumb pain. I had somebody who recently acutely jammed his finger, and he said it's bothering me for a few days. I did one treatment and it seemingly was gone. So I think there's some potential, depending on how severe an acute injury is, that we could get some lasting benefit that quick with an acute stuff. Chronic stuff might take a series of treatments, but as I can attest, and probably a lot of people can attest with chronic illnesses, we're looking for new solutions. We don't want to do surgery. Cortisone injections just cause further joint breakdown. We can only take so many oral anti-inflammatories, whether natural or over the counter. We don't want to pay for stem cell therapy. It's nice to have a tool like this that gives us another thing to try that's very reasonable financially before we jump to those like higher force interventions. I, for one, have had chronic pain pretty much most of my life. I had juvenile arthritis. I wish I knew about this when I was a kid. Also wish I knew that naturopathic medicine existed as a kid, where I would have looked at diet and lifestyle stuff causing that inflammation. But I have a lot of chronic collarbone pain related to chronic bone infection. So I've used that acutely for my pain. I'm finding it helpful. I don't have enough data yet to say it's giving me any lasting results, but also my condition is very, very, very different than anybody else that I've ever seen. So I'm kind of a canary out there. But my own chronic pain, and I guess I bring that up, is because I can relate with a lot of people who've been through chronic pain and people who think they just have to live with this the rest of their lives. It's one of the reasons I became a doctor, and it's one of the reasons I continue to look for more innovative therapies like this that can hopefully give more people more lasting results and benefit. The treatment itself is not painful. There is some heat associated with it. I move it at a certain pace that we don't necessarily cause any burning or any discomfort. It is very fast. We do it within 5 to 15 minutes. After the treatment, there isn't a lot of aftercare that you need to do. I would encourage you to stay hydrated, get a good sleep, eat good food. Doesn't mean you go out and run a marathon. If you have an acute illness, you need to make sure you allow your body the chance to repair. Even though we are applying heat with this device, it does not make the skin more sensitive to sun damage. So if you're like, oh, I just did laser, can I go hang out on the beach? Well, yes, you can. Also, contraindications, I really don't do any work over pacemakers. If you have cancer, I can work on you as long as I'm not near the cancer. If you're pregnant, of course, we can work on you, but just not near the baby or the fetus. Metal implants and joints is fine. We don't do anything on the eye. Whenever you're here for treatment, we wear protective eyewear, so to reduce any risk of any eye damage. Thank you so much for joining the webinar today. Areas that I'm really excited to explore this, I already mentioned for neurodegenerative conditions like Parkinson's and Alzheimer's. We're seeing more and more dementia. I'm really interested in brain inflammation with long COVID and chronic fatigue syndrome. With mold illness, I do a lot of mold illness here at Aspen. And people get a lot of acute and systemic inflammation with that as well. And then finally, I specialize in Lyme disease and tick-borne diseases. And I think there's some ability for this to help address some of those biofilms and some of those hidden reservoirs of those tick-borne infections in the body as well. If you have more questions, please just give us a call or send us a message. We'll be happy to answer them. The front desk is very knowledgeable about the laser. And if they don't know an answer, then they'll ask me and I'll get back to you very promptly. But I hope this was informational for you. I hope for whatever you are going through, you feel like you have a good support team in hand and you're finding some good solutions for what you're going through. I just wish you all the best and a healthy and happy life. Thank you.